This drug is used to treat mild to moderate pain, from headaches, menstrual periods, toothaches, backaches, osteoarthritis, or cold, flu aches and pains, and to reduce fever. Take this product by mouth as directed. Follow all directions on the product package. If you have any questions, ask your doctor or pharmacist. There are many brands and forms of acetaminophen available. Read the dosing instructions carefully for each product because the amount of acetaminophen may be different between products. Do not take more acetaminophen than recommended. If you are giving acetaminophen to a child, be sure you use a product that is meant for children. Use your child's weight to find the right dose on the product package. If you don't know your child's weight, you can use their age. For suspensions, shake the medication well before each dose. Some liquids do not need to be shaken before use. Follow all directions on the product package. Measure the liquid medication with the provided dose measuring spoon, dropper, syringe to make sure you have the correct dose. Do not use a household spoon. For rapidly dissolving tablets, chew or allow to dissolve on the tongue, then swallow with or without water. For chewable tablets, chew thoroughly before swallowing. Do not crush or chew extended-release tablets. Doing so can release all of the drug at once, increasing the risk of side effects. Swallow the tablets whole. For effervescent tablets, dissolve the dose in the recommended amount of water, then drink. For effervescent tablets, dissolve the dose in the recommended amount of water, then drink. Pain medications work best if they are used as the first signs of pain occur. If you wait until the symptoms have worsened, the medication may not work as well. Do not take this medication for fever for more than 3 days unless directed by your doctor. For adults, do not take this product for pain for more than 10 days, 5 days in children, unless directed by your doctor. If the child has a sore throat, especially with high fever, headache, or nausea, vomiting, consult the doctor promptly. Tell your doctor if your condition lasts or gets worse or if you develop new symptoms. If you think you may have a serious medical problem, get medical help right away.